And all new in tonight's Health Center, we're taking a closer look at the impact COVID-19 may have on the heart. I spoke with the president of the American Heart Association, who says there is early evidence of long-term effects on the heart.
There have been a few studies published that have suggested that people who've had COVID, even those who were not necessarily severely affected or hospitalized for it, can have evidence of myocarditis, which is an inflammation of the heart muscle, or other kinds of heart injury. And those numbers in the studies that have been done could be as high as 60 or even 70%, although more recent evidence suggests it may be much lower, perhaps as high as 50%.
Dr. Elkind says some people can experience lingering heart injury even 2 months after contracting the virus, but he says most healthy people will recover and not experience any symptoms. The bigger concern, however, is people with a history of heart disease or any heart problems.
People with heart failure, similarly, may be at increased risk of complications from the virus. You can think of this as people who have these medical conditions are a little bit less stable. They're walking along a cliff in some ways, and the virus may be enough to tip them over the edge. So similarly, people with heart failure, as well as other cardiovascular conditions, use extra caution not to get sick.
Dr. Elkind says one of the most important things we all can remember is the collateral damage from the pandemic, which is why the American Heart Association has launched its Don't Die of Doubt campaign to remind people that if you think you're having a heart attack or a stroke, you need to get to a hospital immediately, because there are treatments available, and the faster you get help, the better your outcome. They really have seen that there are people who won't go to the hospital because they're afraid of the virus. They're saying if you have any of the symptoms of a heart attack or a stroke, get to the hospital immediately, because time is of the essence. The second thing the doctor said is wear a mask, social distance, and avoid large gatherings. He said that's for people who are healthy and especially for people who have a history of heart disease.
Sound advice all the way around. Thank you, Marnie.